Hi, welcome back again. Another question here that was sent to us. This is tough for me. It really is hard to talk about this, but unfortunately we have to, because as you can see here in the picture, you can tell right away this is not normal, right? And it pains me because I feel for the patient that's having to deal with this right now, and I feel a lot of actually anger too, because there are people, whether they are physicians or not, that are doing this to other people. I believe that if you go into the medical profession, you don't want to harm people, you want to help them, right? And if you're doing this to other people, you're just not helping them at all. That's not, you should know that if this is what you're doing, you need to stop right away. That's not helping people at all, okay? What happens here, as you can tell, terrible FUE harvesting, right? So many things are wrong here. The patient obviously is complaining about the overharvested area. It's very hard to cover. And yeah, you can say, well, he can grow his hair. Yeah, right. But even growing here is going to be tough because there's so much that was removed from here. I can tell right away that there were a lot of grafts that were removed very close together. So you see the big gaps here. Likely a bigger punch diameter, so it creates more trauma. You can see what we call TV screen effect, which is a sharp demarcation of that harvested area. We see this sometimes with the robot. When you go and have the artist transplant, sometimes because you have that tensioner device it's a square, sometimes you see this, if the surgeon is not careful to do some blending, it can actually look like this. Don't know if this was done by the robot or not. I'm just going by what he said in the pictures. But, it's very sad because how do you fix this really, right? The only solution for him will be removing all the hairs that were placed and then put it back into the donor, which obviously is not ideal, right? Or do what we call scalp micropigmentation, which is basically going in there and filling in these little white gaps with a darker pigment. Sort of like a tattoo, but not quite, different. But that will be the only solution. Certainly could never go back in this area because the more you take from here, obviously the worse it's going to become, right? Exponentially worse. Luckily, the sides have still been left intact, and he's asking part of the question if he has enough hair for a transplant to the crown. That goes into a whole lot of issues that we could be here talking for hours. I don't know his age. It looks like it's young, so I need to know if he's in medical therapy. If not, he needs to be right away to preserve the hair, decrease hair loss. Yes, there's probably some good donor on the sides that can be used, but again, he can't do anything else about this area. So it's a huge portion of the donor zone that's been already depleted. So please be careful as you're looking for your hair transplant procedure. Choose wisely who is going to touch you for this, because when you have something like this just shows a lot of lack of experience, lack of common sense, lack of knowledge, everything that's wrong, to do for someone. So I don't know if this was done by a physician or by a technician. Whoever is doing these kind of things out there, you just need to stop, okay? Because you're leaving patients with very few options for their future, okay? So I know this is a little bit of a rant here, but we want to educate patients like you to make better decisions on your hair. I'm here to help out as much as I can and to guide you in the right direction. Okay? So call me if you need me.